Hello there, North Texas. I'm Dr. Mark Casanova. Not just North Texas, but even areas beyond who are joining our podcast this morning. We're here representing the North Texas County Medical Society Coalition, a group of 11,000 physicians in North Texas, including Dallas, Tarrant, Collin, Fannin, and Grayson counties. I'm Mark Casanova, an internist, palliative care physician, and a clinical ethicist here in town. And I'm joined today by Dr. Trish Perl, who I'll let her introduce herself.
Hello, everyone. I'm the Chief of Infectious Diseases at UT Southwestern, and I practice both at Clements Hospital as well as at Parkland.
And we're here today on July 9th, 2021, to discuss the most recent updates we have about COVID-19, the good, the bad, and the ugly. What's the significance of the day? Well, it's because what we share with you today may change in a week or two. And that's been one of the universal truths about COVID-19. It's been an ever-evolving challenge, a virus that has little predictability in its behavior pattern. And as soon as we do learn it and feel that we have some confidence about its behavior, it throws us a curveball, as it's done recently with the Delta variant. But before we get into that, let's talk about the positives, because I do think there's some positives. There are some goods that we've experienced together the last year and a half dealing with COVID-19. And I think the major good is the vaccinations.
No, absolutely. Certainly the vaccinations, but also we learned that even what we call the non-pharmacologic interventions really work. We know that masking works, that hand hygiene is really important, so we've learned a lot. But, you're right. The vaccines are the story of the day, and these have really revolutionized how we're approaching this pandemic.
Yeah. On a personal, emotional level, as a palliative care physician, we're accustomed to dealing in the morass of the unknown, caring for patients in the gray zone, right, where there is going to be loss, and we know that. And I think we went through a phase of caring for COVID-19 patients where whether we were a palliative care physician, an infectious disease expert like yourself, or even a critical care doctor, ER doctor, we knew that we had limited tools. And we knew that many of the patients we were caring for were not going to pull through. But it's been an emotional game changer, if you will, to finally have a trick up our sleeves, to finally actually have a tool. And that's really, I think, affected many of us in the trenches, both positively and negatively. Positive that, hey, we are seeing fewer patients come into our doors. We're seeing there for a while less severe illness. Things are changing as we speak. But the vaccines have been just a remarkable advancement.
They are, but I think what's really important to point out is that our tools inside the hospital haven't changed that much. We're still doing a lot of what we call supportive care. We've had a couple of drugs that look relatively promising, but we haven't had that remarkable bullet that we've needed. And so we're really relying on prevention, which is what the vaccines are all about, is we've got to really get everyone to join us in the prevention part of the pandemic, as opposed to into we're going to let you guys take care of us when we've gotten sick, because we don't have a lot of new things up our sleeves.
I agree, and I think that's maybe a message that hasn't really been fully vetted out or resonating in the community is as an infectious disease expert, it's not like our therapies are as powerful as an antibiotic for a run-of-the-mill bacterial infection or pneumonia, where, hey, we're going to knock this out and you're going to feel a whole lot better in the next 24 to 48 hours. We're scratching the surface with our therapeutics. And as for some individuals, infection progresses and you land from at home in the hospital, from the hospital on high levels of oxygen support, and ultimately to our ICU, our effectiveness declines at each one of those junctures. And as you say, we're there to support you. We're not going to abandon you, but we can't really fix you.
Yeah, no. To put it in perspective, these vaccines prevent 95% of hospitalizations, maybe even more than that, which is dramatic. but the drugs that we're talking about, like remdesivir, which is an antiviral, maybe decrease mortality 10%, 20%. It's not that dramatic. So the dramatic story is the vaccine. That's really what's been so impressive. The other thing is that these vaccines have been really safe. That's gotten lost in all of this also is, we were really careful because we wanted to see what the data were going to show, but the vaccines have just almost revolutionized our thinking about this moving forward. Yeah. I think we're going to see this technology in, influenza vaccines and all kinds of vaccines that we use. And what this audience may not really think about is we are now in an era where we don't see the kind of deaths from infectious diseases that we used to, because vaccines are one of the single most important public health measures that have ever been developed.
Yeah. I've got to tip my hat to one of my infectious disease colleagues at my hospital who was one of the study sites for the Pfizer vaccine, who graciously allowed me to become a participant in the study. And my wife's sense of humor is salty like mine. And I didn't exactly tell her I was partaking in the study before I did it, and came home that afternoon after my first shot and said, well, I got this brand new COVID vaccine today, the Pfizer vaccine. And her first response was, well, have you updated your life insurance policy? But, to that point, there were well over 100,000 Americans, young and old, healthy, those with medical conditions, healthcare providers, and lay public who participated in those original studies to vet out the safety of these vaccines and their effectiveness. And I think what we've seen both in the studies and now real world experience with hundreds of millions of individuals who are vaccinated, that these are safe. So there are individuals out there, we know them because we talk to them on a daily basis in our offices, in our hospitals, that may express some degree of hesitancy based on, well, I want more information. I'd like to ensure that it's safe. I think many of us in the trenches would say we're confident about the safety. And for those who say, well, I've read some stories about side effects, it's true, there are a handful of side effects. They are generally mild. They catch a lot of attention. But the reality is the majority of individuals who get the COVID vaccines actually do not have side effects. It's less than 50% of individuals who will experience any degree of side effects. And I'm not a betting man on most days of the week, but I would bet in favor of vaccine over the chance of getting COVID any day of the week from what we've seen borne out.
Yeah, absolutely. And honestly, I do think that the FDA is going to be approving these vaccines fully this summer. We're waiting with bated breath. So I think that's going to be happening, and that the FDA is really going to agree with not only our impressions and what we're reading in the literature, but also with the additional information that they have at hand that is not necessarily in the scientific literature as of yet. So, right. This isn't just you and I. I think that it goes way beyond you and I. The other thing that I'll just say, we talk a lot about side effects, but nobody talks about the most important side effect of these vaccines, which is, gratitude and relief. And that's really what a lot of people feel when they get vaccinated. Yeah. It's just that safety valve, and that very important, untangible feeling that everyone has once they've gotten vaccinated.
Yeah. Well, and moving above and beyond that, it is, at the end of the day, our only effective ticket to freedom, to true normalcy, not the quagmire that we're still living in right now, despite things being open and relaxation of recommendations. We're still in a half-assed quagmire. We're not normal.
Well, and I think that's really important to point out, is that, everyone has really attempted to try and enhance the economic recovery, the physical recoveries, the psychological recoveries that are needed. But, the reality is this pandemic is not over yet. And we are seeing that. There is a lot of the world that hasn't had the benefit of vaccine. And we live in a global society where, people are flying all over the world, et cetera. So, we are at risk of having additional, as you would say, curveballs thrown. And until we get large numbers of people vaccinated, we will have more variants and more challenges. So this, even though we've been able to normalize a lot in the United States, we still have big challenges, and we're going to have to really work through this as a society for a while. I don't know how long that while is, right, but a while.
Well, and I think you're right. And actually that serves as a great transition point from the good into the bad and the ugly, because the two are inseparable. Though, to just touch on how long is a while, or how long is this spell going to be, the good news is there are many things we cannot control about a virus, but some things we can. Yeah. And we actually are in control of the time frame. Yeah. We are, as a society, as individuals. When we reach that critical mass of individuals who have true protection from vaccination, normal will come back. But to transition into the bad and the ugly, and you touched on a few key points. One is what I think inherently catches everybody's mind when they think COVID-19. Am I going to die from this, or is a person that I love and care about going to die from this? And then you touched on, the importance of economic recovery and recovery of life. And I think what we miss sometimes is that the death rate is a set number. It's, 600,000, over 600,000 fellow Americans have lost their lives. We aren't even aware of the individuals who have been crippled by COVID, who are alive, who can't return to work, who can't function fully and normally. We don't know what those numbers are. I saw a patient in my office yesterday, a social worker who I've been caring for a while. I've seen her and knew her pre-COVID and post-COVID. You could argue success. She recovered from COVID. Her entire family unit was regrettably infected, but thankfully everybody survived. She has to bring a notepad into our office. She has difficulty finding words. She has, as she refers to it, as the COVID brain. And that's real. And we know very little about how long that will take to recover. We don't have a clear number on the number of individuals who are now on kidney dialysis or oxygen at home at the age of 40. And sometimes in my field, some might say, well, there are worse things than death, i.e. suffering and that. And I think that we hope that the public will understand that there are sometimes worse things than death. And if you're 20, if you're 30, and your life is now forever changed, that's going to be hard to recover from.
Yeah. Now, we label this rightly or wrongly long haulers, yeah. And there are a lot of symptoms that we're just beginning to understand, but clearly there are a group of individuals who have long-term what we could say sequelae, but from this, and it's beyond this very, and you're right, they call it a foggy brain. We're seeing people who are short of breath, who have, for prolonged periods of time, there are individuals who've got cardiac problems. So there's a constellation of symptoms that we put in this bucket, for lack of a better word, with long haulers, and we're worried about that. The other thing that we aren't talking about is some of the mental health sequelae, and some of them are directly related to having the virus, and some of them are related to the pandemic. But that's another huge impact, if you will, from this.
Yeah, I've had weeks in seeing patients in the office, and to a person, patient after patient will spontaneously express struggling with depression and anxiety to levels I've never seen before. Let's talk a little bit about Delta variant, the latest curveball that COVID-19 has thrown us. And, I think it's also important to understand that while we said earlier, we can't control all aspects of viral behavior, but sure as heck, viruses are dependent on us for behavior. So I think it's sometimes not always clearly understood when we've been harping and preaching and shouting from the mountaintop. We need to get this under control as fast as possible. Otherwise, there's going to be variants. And it's simply because, unlike bacteria or other organisms, viruses are completely dependent on us to reproduce. They're not replicating or reproducing other little COVID buggers out there outside of our bodies. So as long as they have access to our bodies and we're not protected, they're going to enter our nose, enter our mucous membranes, and go to work, producing literally thousands, tens of thousands, sometimes millions copies of themselves. And of those copies, there's going to be mistakes. There's going to be mutations. And sometimes those mutations are worse than the original. And I think that's what we've seen with Delta.
No, absolutely. The Delta virus, so the first of these variants that emerged was the Alpha virus that was 40% more infectious than the wild type, the original strain. So already you had a significant impact just because it was so much more infectious. And the Delta is 40 to 60% more infectious than the Alpha. So if you took that original strain, it would transmit to 2 to 3 people. I have original COVID. I'm going to give it to 2 or 3 people. You now look at that Delta strain, it's actually going to transmit to 5 to 8 people because it's that much more infectious. These are what we call fit. They're very fit viruses, and they're smart, and they want to survive. And so these variants or these mutated viruses are going to survive and outcompete the viruses that weren't quite as fit.
Right, yeah.
And transmit.
Yeah, I think, sometimes as an Aggie, I put things very simplistically. If we put this on a scale of badness, you got bad, real bad, and shamalama ding dong bad. Bad is your seasonal flu, which, let's not forget, anywhere from 10 to 40,000 Americans will lose their lives any given year, depending on the severity of the flu, which, as an aside, by the way, it's pretty quiet last year with masking. Real bad is the original variant of COVID-19, 600,000 American lives lost, and not to mention those that will continue to be lost with the Delta variant. And that takes us to the Delta variant, which is shamalama ding dong bad. It is a highly contagious, highly virulent jerk of a virus. No other way to put it. It's a challenging virus. And we talk about that transmission of 1 in 5 people or that R naught. I think what we're seeing, and this gets to the interplay between the good and the bad, is that even our transmission here in North Texas is still an R naught of 1.2. So we talk about the positivity and the good of the vaccines, but without an adequate number of individuals protected, we're still spreading.
Exactly.
Deep in the community. Exactly. So I think, that's one of the reasons we're reaching out to the public today, is to say, listen, this isn't over. You may be done with it, but it's not done with us.
No, and I think we're seeing, so these are all numbers and they're vague numbers to the public, but, what's our impression in what we're clinically seeing? Well, the numbers are going up. It's not dramatic. It's not going to knock your socks off, but they're slowly creeping up. Hospital admissions are creeping up. Nothing dramatic. No, we're not out there waving flags, but they're creeping up. Census, we're getting a few more people creeping up. What's just so striking is everyone who's getting admitted is not vaccinated. They are not vaccinated.
Yeah.
We are not seeing people who are vaccinated getting admitted. And the even more heartbreaking part of it is that they're younger.
Exactly.
And they don't have underlying diseases. It's not like you can turn around and say, well, this person had cancer or had this or had that. I mean, these are people who are totally healthy and have no reason to really be getting that sick. Yeah. And, it's not that what we haven't seen has been dramatic. Right. It's just, this is kind of more salt in a bad wound.
Exactly. And you're absolutely right. I can, recall a year ago or even multiple months ago, seeing COVID-19 patients and you had a spectrum of patients, but a good chunk of them, their stories read very similar to each other. Mm-hmm. Older-ish, it's all relative, and chronic medical conditions, obesity, diabetes, high blood pressure, cancer. We know the list pretty well. And then you would still see, however, that occasional 30-year-old in that mix.
Right.
That healthy 50-year-old marathon runner who you lost.
Yeah.
And you were really taken down. And I used to talk about the unpredictability of COVID. Now, in a strange twist, we're seeing a whole new cadre that almost mirror each other. 20-year-olds, 30-year-olds, 40-year-olds, and every one of their story reads the same. 40-year-old gentleman, no significant past medical history. And, there's been a lot of chatter and discussion about discrimination, right? Well, we can't ask somebody if they're immunized or not. How do you handle this? Are you masked? Are you not? In this setting, the virus is discriminating violently and viciously against individuals who aren't vaccinated. It's like you've got this large population of young individuals, and the virus is just hitting them disproportionately harder.
Yeah, I don't think that people really understand. I think they feel like they're not vulnerable. And, now that a lot of the older population, I think in North Texas, we've done a really good job at getting that population vaccinated.
Absolutely.
They're just, they are the product of our success, and they're not getting sick.
Right.
But we haven't really been as effective in vaccinating that younger population. In fact, it's pretty bad. Right now, in this area, it's around 2/3 of the population who can get vaccinated needs to be vaccinated.
Right.
So, it's not that people haven't done a good job and haven't been working hard. They have been. But right now, we need to really refocus our efforts and start, getting to that group of people who don't think they're at risk, and because they are.
Right. We opened our discussion today with an acknowledgement that today is July 9th, and what we're sharing with you is data today. We just learned some key information yesterday as we, finish up our conversation today about protection if you've had COVID-19, right? Because I think that's one of the issues. There was a lot of spread, and there continues to be a great amount of spread amongst younger-ish individuals, right? And so it stands to reason, and what we learned from querying these people, that many of them say, well, I had it, why do I need to get a vaccine? And article in Nature yesterday is informing us what both you and I have seen clinically is, hey, it's not protecting you.
It's not. I mean, we've known natural infection, the immunity from natural infection is not as robust as what we've been getting from the vaccine. Mm-hmm. I mean, clearly the vaccine, as I've said, it's just remarkable in terms of the immunity that it's giving you. And it's giving you a much more durable immunity. Mm-hmm. So the vaccines have done a very good job. Natural infection, for reasons we can go into. This is what we call an RNA virus. It's not just your innate immunity. There's probably mucosal immunity and all of these things that are really important. So how does this virus work? For all of these reasons, the natural immunity is not as robust. And this article that you're talking about basically supports what we've been seeing clinically, which is we are seeing reinfections in people who have had COVID. We are seeing very few secondary infections in people who are vaccinated. Are we seeing them? Yeah, not a lot, like 0.04%.
Right, and pretty mild.
And
generally mild cases.
Very mild. But in these people who are getting reinfected, we are seeing this again. And so there is this misconception that I'm protected. And the bottom line is you're not.
Yeah.
You are not, and you need to go out and get vaccinated because that's the only thing we can tell you right now we know is going to protect you.
Exactly. And get vaccinated for yourself. Get vaccinated for those that you love. Get vaccinated to keep your job and your livelihood. But get vaccinated so that every single one of us can get back to true normalcy.
Right.
Not the half-assed quagmire that we're still currently living in. If we want normal, it's in our grasp. So go out and grab it. Roll up your sleeve. Get a shot in your arm. It is safe. And it is thousands of times safer than running the risk of acquiring COVID-19. So thank you for joining us today. We look forward to sharing more information with you as we get it. But help us help you and get that vaccine.